Welcome to the presentation of this case study at Interact 2021. My name is Anna Spagnoli. I'm with the University of Padova, and I will present this work on behalf of all the other co-authors, Luciano Gamberini, Enrico D'Agostini, and Giulia Cenzato at the same institution. This case study regards the treatment involving the use of some medicine. The success of medical treatment depends on the patient's adherence to the prescribed timing, dosage, and frequency of medicine intake. Unfortunately, adherence is a global problem in terms of health and health costs because non-compliance is very frequent, as reported by the World Health Organization. A review by Jane and colleagues in 2008 shows what are the reasons for non-compliance: involuntary forgetfulness by the patients, miscommunication between the patient and the caregiver about the structure of the treatment regime, complexity of the regime itself in terms of number of different medications to take, and finally, a lack of motivation in continuing with the treatment. Many of these problems depend on the fact that the patient is left alone with the treatment at home. Therefore, an assistant could remove many of such causes of non-compliance by reminding the patients to take medications and keeping them accountable for the continuation of the treatment. This kind of assistance can be done by adherence apps. Adherence apps are applications, most commonly mobile applications, whose goal is to assist the patients during the treatment prescribed by the physicians. They do not make any prescription or any diagnosis themselves. It has been shown that they are more effective in the long run if, in addition to reminders, they also include behavioral strategies, just for example, setting goals or receiving scores and badges, and if they also include the history of the medicine intake and of the data collected from the patient. If these applications adopt a conversational format, this also improves their effectiveness in comparison with one-way reminders. Conversational formats are also easy to use and more intuitive to the patient. Clearly, they do not chit-chat with the patient. They engage in goal-oriented transactions with the patient, aiming at providing instructions or collecting data. The response from the patient can be entered as a free text or more commonly with predefined answer options. Although these applications mainly address the patient, they reflect the agendas of other stakeholders: the physicians who monitor the treatment, the pharmaceutical companies that monitor the product's effectiveness, and the developers who needed the application to be effectively designed and sold. This last consideration inspires our case study. This case study focuses on one application called Patch AI, whose goal is to monitor the conditions of patients under medical treatment at home. It adopts a conversational format with predefined answer options. Our goal was to clarify the stakeholders' expectations and derive some design recommendations that could be useful in the subsequent iteration of the application development. The participants in this case study were representatives from each class of stakeholders we have considered before. 6 patients who were not currently using Patch AI, but were familiar anyways with the medical trials in which data are collected from patients. They were described how the application worked before the interview. Then we included 3 physicians who were using Patch AI with their patients, 2 representatives of pharmaceutical companies using the application in their trials, and 3 developers from Patch AI itself. The interviews lasted 30 minutes. They were carried out individually via Zoom. The informed consents were collected before the start of the interview via email. The interviews regarded the perceived role of the application. They were semi-structured with some predefined questions and some follow-up questions. The predefined questions regarded the usefulness of the application, its advantages and its disadvantages compared with other data collection tools in trials, the reasons why patients would discontinue using the application. We started the data analysis by transcribing and recording all the interviews. Then we performed a thematic analysis. The thematic analysis is a qualitative method to try and identify some recurring themes in a text. In this case, the themes of interest to us were, of course, the roles attributed to the application. During the first bottom-up stage of the analysis, The researchers read the transcripts, extracted the recurring themes from the texts, and then defined these themes. During the subsequent top-down phase, 2 researchers who did not participate in the previous phase coded all interviews based on the themes. That is so independently from each other and then met to resolve any disagreement. In this way, we found 373 mentions in the interviews to the application roles. The agreement percentage in the independent coding phase was 76.8, and the number of themes that were extracted with the analysis were 6. These are the 6 themes. The application is seen as a secretary, a guide, an interlocutor, a safe box, a lifesaver, or a travel mate. Let's consider them one by one. By secretary, we mean that the application assists overloaded physicians by taking on the burden of collecting, storing, and aggregating the patient's data. Alternatively, the application is referred to as a guide that can keep the patients within their intended medication regime and help data entry with intuitive interfaces. A third role, which is attributed to the application, is of an interlocutor, since its conversational format turns a data collection process into an empathic conversation. Fourth, the application is referred to as a safe box because it allows to keep and preserve the data safely and transparently and to make them accessible to both patients and physicians. Another aspect of the application is that it is a lifesaver. By providing their data, the patients play an active role in the treatment, become more aware of the effects of the treatment, and make themselves useful to research. Finally, the application is seen as a travel mate because it is always with the patients during their sickness. So 6 roles attributed to the same application. Then we checked whether these roles depend on the type of stakeholder we interviewed. We did so by looking at the ways in which the roles are mentioned by the different stakeholders. The data in this table reported the number of mentions to the different roles made by each stakeholders group, averaged by the number of participants in each stakeholders group. We will analyze the table descriptively because the sample is too small to allow inferential statistics, and we will look at the table horizontally. Patients. Patients refer basically to the application as a guide, as an interlocutor, or as a secretary. They don't refer much to the application as a safe box or a lifesaver. Instead, physicians refer to the application as a safe box and a lifesaver. They also put much emphasis on the application as a secretary. The pharmaceutical representatives put most emphasis on the secretary role. Perhaps the physicians are their direct interlocutors. And finally, developers put much emphasis on the application as a guide and as an interlocutor, probably because this reflects their concern with making the application usable. Based on the results of the analysis, we provided some design recommendations. First, we recommended to give more emphasis to the lifesaver and travel mate roles because they can boost motivation. This can be done by quantifying the advancements in the data entry process and by notifying the patient when the doctors look at their data. Second, we suggested to consider a potential conflict between the secretary and the interlocutor roles. The secretary's role requires that the application is void of any clinical skills, but the conversational format instead might lead the patient to overestimate the agency of the application. This misunderstanding can be avoided by using explicit disclaimers about the competence of the application, and also by checking that the language in which the conversational agent refers to itself is appropriate. We hope that this case study can provide hints that can be generalizable to other applications. Perhaps the design recommendations are generalizable to applications that have the same features as the one that we have considered here. And also the idea to examine the potential frictions between the expectations of different stakeholders also can be applied to other adherence applications. So now we thank our sponsor, Patch AI, and thank you for your attention.